Welcome back, guys, to another episode of African Voices Unmuted. This is your host, Timothy, and I'm here together with not Sean,
but with Katarina, who is an active member of ASA, and thank you so much for having me today.
Thank you so much for helping on. Sean couldn't be here today, but we have a very special guest, so we couldn't let this episode slip away. Who do we have sitting in front of us?
It is Chris Bangma. I'm a professor in urology at the Erasmus Medical Center. And my specialty for many years, almost 3 decades, has been prostate cancer and men's health.
Wow, 3 decades of advocating for men's health, working in the science field. I think
that's pretty impressive.
This is going to be a very interesting episode. We're students, a boy and a girl, who want to learn more about prostate and testicular cancer, just like the listeners, hopefully, because it's a taboo and a thing that we don't talk about a lot, but something that's very dangerous for especially young men in this society. So, as I said, today we're going to be discussing prostate and testicular cancer. In this informative conversation, Dr. Bangma will highlight the importance of early detection, shares insights into symptoms and risk factors, and explores current treatment options. Do
you want to start off by letting us know how you got into the study and what fueled your interests?
Well, that's, as I indicated already, it's a long time ago. And the interest was simply because I was interested in oncology and the epidemiology of oncology and how to prevent it and to treat it. And I was at the same time very much interested in surgery. And I traveled the world to do surgery in all kinds of, let's say, countries and all kinds of orifices. So I operated on skulls, abdomens, everywhere. And that means that in the end I became a urologist because that was a technological profession, very much in development, with all kinds of instruments and techniques that combined my interest in the basic science, the biology of diseases and cancer, and could combine it with technology and surgery and hands-on.
Yeah. And could you maybe explain for the viewer who doesn't know what a urologist exactly does?
The urologist takes care of the excretional, let's say, organs of the body. So the kidneys, the ureters leading to the bladder, and then distal from the bladder, the urethra in males and females, but also the genital organs. So in the male at least, the testes that are in the scrotum. So that is the field, the area of the urologist. And in between there, in the middle of the pelvis, of the pelvic bone, is the prostate. Yeah. And that's an organ hanging below the bladder before the urine and also the semen passes into the urethra.
Wow, that sounds like a very important part of our body. Multiple important parts. Could you, if you were to give advice to your younger self who was about to get into urology, what would you say?
An advice to people that want to go into urology?
Yeah.
Well, I'd say at this moment the world has changed a lot. So there is a lot of, let's say, technological development, not only in instruments, but also in biology, that make the profession very interesting, but also you need to be on top of it. So you can't sit down and say, okay, I'm studying this for 5 years and that's it. You have to be on the ball. At the same time, it's also very much patient-orientated. So you have to be able to communicate well, as well as in the field of prevention, in which you have to give information, as in all kinds of treatment, and also maybe the disappointment of treatment, because it also has to do with people that are having difficulty with their fertility. Those are young people, but also people that are going to die because they have a terminal form of cancer in the bladder, in the kidney, or in the prostate. So it's very broad, and you have to be very active, and you have to be, most of all, as most students are, very curious in order to follow this.
Wow, it sounds like a
Yeah, and have you, as you've shown, you've dedicated 3 decades of your life to it. It's very impressive.
Yeah,
Yeah.
that's really.
And I have not regretted it 1 second.
That's good.
Wow.
That's good. So can you tell us a little bit more about men's health and how prostate cancer and testicular cancer affects them?
Yeah. Well, as you indicated at the initiation of this podcast, you'd say we don't talk much about it. And of course, that has improved over the years because cancer and infertility or impotence or micturition problems were a little bit of a secret area, but have become more open. So people talk about it more. So that's good. But it also gives the psychological component of the profession very much into the focus. So men's health actually is a very broad subject. And it's actually not only about men, because it's also about women, because they have the same organs almost. And it means that in the issues that they are addressing, they have to work together. So I'd say the men's health issue is broadly acknowledged and more open issue around the world. That's good, because there's especially organizations like Movember, and you had an interest into Movember, are taking care of this global subject, so to say, to bring it to attention and to help it forward by making networks all around the world. Yeah. Now, I myself have been the head of a network that was working for prostate cancer, that is starting prostate cancer, but with an expective management. That is, prostate cancer often does not develop into a wildly beast that will kill you, but you have to live with it for a long time. And that brings about all kinds of diagnostic aspects as well as psychological aspects to manage that. And we had a network around the world in which many very important centers work together in order to develop this concept. Because 20 years ago, cancer was the buzzword and everybody was afraid for it. But for prostate cancer, it has changed into something that you have to talk about, to manage, and to assess well in order to see whether it's a risk for your life or for your health or not. And when it is not, but you're still aware of the cancer, you are a cancer patient. So it brings about all kinds of effects with yourself or in your surrounding. And that area I was heading around the world to say how we develop that, how do we monitor it, how do we keep it in confined to the prostate and not extend it, how might we prevent further growth, and how do we assess this in a time frame. How do we do that safely, and how do we keep the man feeling safe? So it was very interesting to see that.
I was gonna ask about like the different dimensions of your work. Like as a doctor, you obviously treat the physical, but with that, as you said, there comes a lot of mental, issues because it's, mind, body, soul thing. And I can also imagine sexual because some of these organs are used for reproductive organs and are used for, sexual pleasure as well and things like that. And there can be taboo around that as well. So how do you manage to break the conversation with people about their private parts and the risks or the sicknesses that can be there?
Well, management of patients, of course, have very many dimensions, so to say. And you often have to observe very well what kind of a patient is in front of you and try in a split second to feel and see what is the background, who's with them, do they have an active and open mind to discuss things, yes or no. So yes, it is a little bit of an experience because as a young person you're doing that far worse than as an elderly person. At the same time, you also have to realize that there are experts beyond you that are better doing that. So if patients have specific psychological problems, then you often refer somebody to a urologist, sexologist, somebody who has more or less two professions, and we have those special persons in urology, just like we have also the special operating persons in our profession. So it means that you split it up. I mean, the field of urology is very broad, and therefore also treating the patients with their specific problems might have to be a case of referral to an expert and experienced doctor.
Okay. So shifting the topic closer to prostate cancer and testicular cancer, could you tell us more about what are some early warnings? Well, first, what is prostate cancer? What is testicular cancer? What are the differences particularly for the viewer that doesn't know?
Right. Okay. Well, cancer in itself is per definition a disease of your DNA. So your DNA doesn't work the way it should be. It explodes more or less, and it starts growing cells in an uncontrolled manner. Your immunologic system or your anatomic system does not keep the cells in place, and they might in the end also spread beyond the organ in which it started. Now, for prostate cancer, also, it of course starts in the prostate, just like testicular cancer starts in the testes, and then it might grow to spread, and then it might also give symptoms. In the case of prostate cancer, it might just start in the gland without knowing. So you don't see it. You don't there's no symptoms around.
Yeah.
And it actually only comes to the surface when it has spread already. And then it is a deadly disease. When it has spread to the bones and you feel a small crack in the bone, it's very painful. Then you notice, okay, I have to go to the doctor. And then you're too late. And there might be other symptoms like that too. So that is ugly, and that's the reason why, of course, people have been looking for the last decades for how to diagnose it early in an asymptomatic stage, and actually that is more or less screening. And for testicular cancer, it is or might be more or less the same, but often the testicular cancer is noticed earlier because they're more to the surface. So by self-inspection, men notice, or their partners notice, that there's something wrong with the testes, that there is a node on it. And then they are alarmed and go to the doctor, and there are a very fast care path is being followed. Because the main difference between these two cancers is that the DNA disturbances in the prostate might be very, very, very many, but they grow very slowly, or reasonably slowly, compared to testicular cancer, which is a fulminant disease. And it started actually very early in life, maybe also at the time that you were an embryo, so in utero. Okay. Well, prostate cancer starts probably around 30, 40, at the age of 30, 40. So these are completely different diseases. But the testicular cancer can grow very fast, and that means that whenever you notice a node, you have to go to a doctor, you have to see a physician immediately. They will make an ultrasound, and if it's wrong, then they will immediately bring you to operation room in order to remove the tumor or the testis.
So it's
It
instant.
might spread very fast. And instant, then it means that is a couple of days.
Yeah.
I don't think a lot of people know
No,
that
not at all.
once you feel something which is irregular, you should immediately be operated in that case.
Well, you should consult the doctor.
Yeah, I mean,
because irregularity might be something different. It might be some kind of harmless calcification or an infection or growth or anything else. But when you're between 20 30 years old and you notice this, you know it's probably existing there for already 20 or 30 years because it starts early in life. But then you have to be fast to go for consultancy. And sometimes that even means that at the time of detection and staging, because that's what the doctor does, he's going to look, where is it? Is it only in the testis or has it spread around? CT scan will be made, and if they notice that it has spread already, you will get immediate chemotherapy in order to stop it. Well, the good news is the chemotherapy or the treatment of testicular cancer is almost 99% to be healed. So
That's so hopeful.
so that's good
So
news.
hopeful.
Yeah.
So you know about all these stories about famous sportsmen that were diagnosed with testicular cancer, got that treatment, and a year after they were
really?
already at the same level of biking or swimming.
I've never heard about those stories.
Yeah. Testicular cancer is apparently like
Yeah.
a relatively high survival rate, which brings a lot of hope
Yeah,
to, Is that because of the research that has gone into it, or?
definitely also.
Yeah.
But also because of the different cancers, the different type of cells where it started in.
Mm-hmm.
And testicular cancer is very susceptible for chemotherapy.
Oh, okay.
Okay,
So
so
that's good.
like I didn't even know it was that common. If I'm being very honest, I didn't know it was something that could be like just solved with,
Yeah,
you know. I
yeah.
don't know.
Well, it's maybe not that common because it's maybe, well, let's say 1 or 2% of the incidence of prostate cancer. So it's
Oh.
definitely not common. And as far as we know, it's also not inherited, while prostate cancer in 10% can be. So these diseases, although close to each other anatomically, do not have any relation with each other.
Okay.
But the incidence of testicular cancer is low, also around the world, and actually the highest in Western countries where we have to cope with all kinds of pollution and environmental factors, and those are, we think, related to it.
Okay.
Because if you look at the incidence of testicular cancer in the African continent
Yeah, we were just
and
talking about the
and
flag.
sub-Saharan continent,
Yeah.
sub-Saharan Africa, then it's actually very low. It's detected annually in one of 100,000 men.
Wow.
While
Okay.
prostate cancer is being detected 60 times more often. And it's, especially in sub-Saharan Africa, has the highest incidence around the world.
Okay.
Okay.
It's 60 men being diagnosed per 100,000 in Africa at this moment. And probably detection and registration is not that good, so it might be a lot
Even
higher.
more,
So this is, again, an enormous difference between the two diseases of this men's health issue.
Yeah. And what would you say, like, what have you noticed is the difference in what people think of prostate cancer or testicular cancer? Because I can imagine that a lot of people think it's the same thing or it's similar. And even I know that it's two different, organs in that, or body parts. But I would put it in the same category. Well, it is not. Like, it's a whole different thing. Like, what do you think are misconceptions about these two diseases?
Well, I haven't met many people that make an association between the two.
Mm-hmm.
So most people, I think, know that there is a difference between the two. But if you make it very easy and say, well, testicular cancer is for young people, prostate cancer is for older people.
Mm-hmm.
Testicular cancer might grow very fast once it's detected. Prostate cancer, only, let's say, 20% grows fast when it is detected.
Yeah.
The testicular cancer may affect reproducibility because when treated, you have to take one testis out. You still are fertile. And you still have testosterone as a male hormone in order to all the functions that you want to function with testosterone. While prostate cancer doesn't affect your reproducibility at all because you're older. I have to say, when you have to take the prostate out, of course, you don't produce semen anymore. At least you can't expel it. So that means it does affect, but because most of the people are elder, you won't. It will not have an impact so much on reproducibility, and definitely not on the testosterone level in persons.
Mm-hmm.
But when we talk about treatment of the prostate, then you can see that other things are affected.
Wow.
Yeah. So earlier you mentioned that you are sort of drawing links between pollution and testicular cancer. Are there any other like lifestyle choices or things that are likely to bring along testicular cancer or prostate cancer?
We don't think so for testicular cancer.
Okay.
And at this moment, avoiding with all kinds of chemicals is very difficult because they're all around us.
Yeah.
We've got
Very
all
true.
kinds of plastics in our body already.
Yeah.
So, and we don't know exactly the influence of that. We
Mhm.
do know that certain plastics, for example, do alter our hormonal system. And that might have an impact on testicular cancer. And for the rest, only when you're being born as a baby and they can't find your testes at that moment, they might be inside of your abdomen, and it will be diagnosed as a risk factor. And the testes will be brought down by an operation when you're a small kid in order to be able to check those undescended testes. And undescended testes are, per definition, have a higher risk of degrading into a cancer.
Okay.
But there's a very, very, very small number of infants that are having that. And when you're 20 years old and you're a student, you're beyond that age. Now for prostate, it's quite different because this is slow growing, and we definitely know that, for example, food and environmental factors have an impact. So if I tell a story about the Japanese that are having a special diet, it's not a diet, it's a food pattern, but they don't eat red raw meat,
Yep.
they eat raw fish, they eat a lot of soy and a lot of vegetables, but and they don't have so much prostate cancer at all. But when they move to Western world and they start eating Big Macs, then they get prostate cancer. So we know from epidemiological studies that food and environment have an impact.
Oh, wow.
And that's where you can go into prevention.
Yeah.
So,
And I noticed, like, before we started the podcast, you were talking about the flag that we have hanging here in the studio, the African flag, and you said it represents the rates of these types of cancer in Africa.
Yes.
Would you elaborate, maybe?
Yes, more or less. Well, the World Health Organization annually gives us maps around the world of all kinds of incidences of diseases and cancers, including, of course, prostate cancer. And the high mortality of prostate cancer takes place in Central Africa and the south of Africa. It's then in those World Health Organization maps being depicted as a darker colored red instead of the light red that is, for example, as I mentioned, in Japan.
Yeah.
So there you see that the mortality in Japan is far much lower than in sub-Saharan Africa. The north of Africa, so Egypt, Algeria, etc., there the incidence is, or the mortality is as high as in the south of Europe. While the incidence of the mortality in Europe also has a peculiar distribution, because in the Scandinavian countries, so a little bit like in Netherlands, mortality is far higher than in the southern countries. And maybe that has to do with vitamin D and sunshine, but also with olive oil and better tomatoes and that kind of thing. So it's that's interesting to see. So for the African map, you can see that going to the south, the impact of prostate cancer is higher in terms of mortality.
is there any specific reasons for that you're aware of, or?
We don't know exactly. We have been doing, of course, all kinds of molecular studies and genetic studies in that. The only thing we know that is that the androgen receptor, that is a means on cells that picks up the testosterone from the blood and brings it to the nucleus of the cell, and there in the nucleus the DNA is going to work, that the androgen receptor that is doing that, taking that trafficking of testosterone, is a little bit different from other populations around the world.
The ones in
Africa.
Okay.
Yeah, let's say in black people, in African people. So it's also amongst African Americans.
Yeah.
But there are a few associations with what is it doing, because testosterone works on very many processes in the body, on your fertility, but also on your muscles, and so it's not operating as a one-trick pony, but it is doing many things. So it's also very difficult to find out why is this estrogen receptor upregulated in Black African people. Where is it connected to? So it's not easy. And up to now, at least, we have not been able to influence that or to show exactly where the mismatch is that results into cancer.
Wow.
But there is research into it, and
There is research ongoing, of course,
Yeah.
but this is quite difficult research.
Yeah.
Just as we do not know where food is influencing the cells. We know something about methylation and blah, blah, blah. So there are processes that we know of, but it is always very difficult to find an exact link or pathway that is directly working into the cause of a cancer. And maybe there are, like many other processes in the world, often many causes instead of just one.
And it sounds like, especially if like Black men are maybe at a higher risk. If I'm not a doctor, so I'm just, like it sounds like a conversation that should be had more. But I also noticed that people are also scared of the doctor. I think that's something we don't talk about, but I'm also scared of the doctor sometimes. Yeah. And I'm sure you also sometimes are.
The doctor at all, no.
Like, I went once to my doctor, and he seems like a nice guy, but it's just, I don't know.
It's even just starting that conversation of, I think something's wrong.
Like I could be sick. Oh no! Yeah. Like, it's so terrifying. Yeah. And how do you think we could encourage each other to, stop listening to what's on Google and go to the actual professional, actual expert in these fields?
Yeah, it's a good question, because on the internet there's a lot of fake news or skewed news or whatever. Yeah. So it's difficult to find the correct one. So the easiest thing is, of course, to go to a knowledgeable professional and get over your anxiety. But we are aware that anxiety and misinformation, malinformation, whatever you call it, or just neglecting information is pivotal in order to reach out for higher risk groups. That's why we have quite a number of programs also here in the Netherlands in order to show how we alter that awareness. And I'm in fact the leader of the Dutch Cancer Organization that is taking care of that program between alpha, beta, and gamma scientists, and it's a unique collaboration in order to find out how we influence the awareness in people that have not the skills to understand everything biologically, etc. But to take that over, you say, well, anxiety and finding the good information starts with indeed accepting that there is information. Students, on the whole, do that because they're looking for information and they're going to trustworthy sources, of course. And then you have to accept that when you are in a risk group, that you have to take care.
Yeah.
And are there any resources specifically for prostate and testicular cancer that you could suggest to our audience for them to go for screenings, or is there organizations?
Well, there's a plethora of organizations around. So you can go to Movember, it is worldwide, and have a good website and gives you information about men's health issues, testicular cancer, prostate cancer. Depending on the language you'd like to use, of course, you can go to Dutch organizations like the Dutch Cancer Foundation, but also the networks that are taking care of prostate cancer, like the ANSA network here in the region, and they provide you with information. There's good sources of information and understandable information.
Wow. I think this is such a valuable conversation to have, because I honestly, as much as the people on the podcast maybe are learning new things, I am also learning new things. Like,
100%.
yeah.
Yeah.
Yeah, I think that you have to realize that as black African man, that you have to look around and look into your family, which is often not very easy, because the family build-up is different than in the West. But if you know on the male side, but also on the female side, whether there is cancer of the prostate at the male side, or cancer of the ovaries, or breast cancer at the female side, then you have to take aware that together with your black origin, you have an extra risk of developing prostate cancer.
Yeah.
And prostate cancer is much around. It is by far the most present cancer in the world in men above 50. And as I told you, most of these cancers might be harmful, but when you're in a risk group, they might be more aggressive. And there are indeed, because of these biological differences, there are indeed signals that in African men, prostate cancer is more aggressive, and therefore should be treated also more intense, and or maybe diagnosed more intense than we are doing at this moment.
Yeah. And how would you say we as black men or the African community can start, preventing ourselves from, like, using more preventive measures to try to prevent these things, even if maybe we don't go to the doctor, which you should be doing, but like I can't control people's decisions. So what could we give to the people who don't go to the doctor but still don't want to get cancer?
Well, if your question is, can we prevent it? Then you're preventing something that might occur when you're 40 or 50.
Yeah. That's true.
So that means that most of people of your age are not that much interested.
Yeah.
Because it's far away.
Mm-hmm.
If you want to prevent it, then change your diet and just live healthy. Don't eat meat or not too much.
Mm-hmm.
And take cooked tomatoes, vegetables. That's the best. But most people are not very much interested in that. That's a thing that you can do. Second thing you can do, just realize what the health of your family is. Because if the cancers that I mentioned are there, then you have an extra risk. And that means that you might go to a doctor when you're 40, 45 and say, could you look into my prostate health and see whether I have a risk. They will take a blood from you for your prostate-specific antigen, that's a circulating antigen or protein in your blood. And when it is increased, then you have a higher risk. So the detection is not that difficult. And then if it's increased, they might go for a scan, which also not very intense. So the diagnostic procedure up to that level is not too much. But after that, of course, when you're still at risk and they detect something, then diagnosis and treatment might have an impact. But for 20 years old, you don't think about it. You might think about it because your father is at risk. Could be. The issue that most of the students are concerned about is their sex life, of course.
Yeah.
Because they think, okay,
that's also
prostate cancer.
That's so.
I forgot about
Yeah, that was also
like,
more relevant.
that's
now,
also
but-
true. Like we are worried about something, but maybe we should also be worried about the other thing.
Yeah.
Like not just the pleasures, but also the dangers,
Yeah.
or taking care of the thing you like to use.
Yeah. No.
But that will not be affected
No.
by the prostate cancer in such a way that it will affect you now. So those two have nothing to do with each other. You won't lose your hormones because of a prostatic disease.
Yeah.
But the prostatic disease anyway is not at the level of detection when you're 20.
Yeah. And okay. So when, like, if I were to go to a doctor right now, do you think they could detect or like Like, what do you think a doctor could tell me? Is it possible that I have prostate cancer right now? Like, those are anxieties that people have. So
No, it's not detectable.
it's
The
not
doctor will
detectable.
say, come back in 20 years.
Okay.
Yeah.
Okay.
And-
But the
to
doctor
learn-
might say, take care of your
Yeah.
diet.
Okay. So it's really the diet and your. Are there also, Katerina asked this earlier, but what about lifestyles? So are there things as a student you could avoid? Avoid. There's a very big drinking culture, smoking culture. Like, obviously, those things might have impact, but is it related?
Of course it is.
Yeah.
Because cancer start with for many different reasons. Smoking is just bad. And it's connected directly to bladder cancer, not so much to prostate cancer or testicular cancer,
Yeah.
as we know. But I mean, bad habits will, in the end, but not now, have a result.
Yeah.
Okay.
Wow.
Gone through all of that.
Yeah. Is there maybe, like, as we round off the episode, could you maybe share, like, without naming any names, like a patient experience that really touched you? That was like, if we would have seen this earlier, it would have been so different to maybe inspire people to maybe see parts of themselves in these patients, because I think people see people with cancer as very distant from themselves, like, oh, this could never happen to me, when if I look around my circle, I've lost already multiple people to cancer in my life, and I'm only 19. Just for people to, relate a little bit more. Yeah.
Well, I think the best examples for testicular cancer are just in the newspapers.
Yeah.
Because somewhere or another, as we identified earlier, these sportsmen, etc., are having a podium to show, okay, people look at your testes, at least palpate them once a year. And I think that students are doing that many more often than once a year. And just realize and overcome your anxiety to go to a doctor, because something might be wrong, but you might be completely healed of it when you're in time, and it will not affect your condition later in life.
Yeah.
And it doesn't need to affect directly, maybe in minimal cases, your fertility. So it is important I think those are the examples of patients that strike most.
Yeah.
And in the elderly, there are so many things, and you're always most impressed by the diseases that go fulminantly. And in a 45 years old with disseminated, spread out prostate cancer, which is going very rapidly, these are the exceptions, but they come to you because they leave a healthy family and young kids, and that's, of course, awful. And that still happens, because even with prevention of prostate cancer, so if we look into it, then we can only prevent the bad cancers in a small subset of their incidence. So maybe 1 in 6 we can prevent death through by means of the prostate cancer.
Yeah.
So there is a window of opportunity, and that window is concealed because it is in an asymptomatic phase, and that makes it very frustrating, of course, when you see that patients enter in your consultation room and they have wide outspread cancer. So you'd like to make the conditions in countries in such a way that early detection and going more early to the doctor would be feasible. Now, I've been in Cape Town a couple of weeks ago in order to discuss this also with the physicians over there in Cape Town, how to address this, because they are looking indeed at patients 60% of the time that with disseminated disease, while here in Europe it is maybe 10%, maybe even less. So, and over there, their life expectancy is at this moment something like 63 years old, while here it's 87. So
That's
even if
such a
conditions
big
in Africa and sub-Saharan Africa are going to be better because there's better general health.
Yeah.
There's a huge number of prostate cancer patients that is going to need to be addressed in the health care system over there.
Yeah.
It's an enormous, threatening problem.
Yeah, that's also right.
So, and that makes me sad looking
Yeah.
at patients and saying, okay, wait still, worse is still to come.
Mhm.
Yeah, I think that's also one of the main reasons why ASA wanted to like draw light on the topic, because
Yeah.
it's just not, it's an issue and it's just not talked about it back home. So yeah.
But on every level, it's an issue. It's
Yeah.
an issue on the personal level,
Mhm.
how to overcome your anxiety to be tested when you belong to a risk group, as on the governmental level, how
Yeah.
to address this enormous problem that can eat all our financial resources for healthcare. We can only do so by preventing it.
Yeah, and as we mentioned earlier, like men's health, we've talked about mental health and the different types of cancer, but again, it's really multidimensional, so it really affects the physical, mental, and sexual. So please, guys, make sure to take care of all your organs, from the brain to your penis to your balls, prostate and everything.
Yeah.
Any closing remarks, maybe, Katarina?
No, just thank you so much for coming. It's been very educational.
Yeah.
It was very.
Wow.
There's a lot of things there that I wasn't unaware of, and I mean, yeah, it's great to learn. It's great to find out. So I appreciate that. Thank you.
And yeah, for me, just again, also thank you for coming on our podcast. I was wondering, why did you agree to coming on our podcast?
Because I realized that at multi-levels, it has to be started. The awareness has to be started.
Yeah.
And it gave me the opportunity to reach out to population on risk for themselves, for their family, for their countries, in order to take action.
Yeah.
And you are the generation to do it. So, boys, stand up, take action.
There we go.
Yeah, there's no better way to end the podcast.
Yeah.
Boys, stand up. Let's take care of ourselves before we are men, and these things could affect us. So let's change up the lifestyle, healthy diet.
Yeah.
Yeah. Thank you so much. Yeah.
It was great to be here.
It was a very great conversation. I'm honestly really, very positively affected, and I hope you guys are as well. Please follow us on Instagram, TikTok, where we try to promote these things. Open the conversations with your friends, because at the end of the day, we're not doing this to, do anything but spread awareness.
Don't stop talking about it, even after the month is over.
Exactly.
Don't stop talking about it.
In this episode might be uploaded in December, but it's a long year topic as well.
Yeah.
Thank you, Dr. Bangma. Is there anything you want to promote?
I think we said it all, and once again, take action.
Yeah.
Thank you, guys.
Thank you so much.